Welcome back, dear viewers. We have been joined with our guest here in the studios of Hala Kuwait, Dr. Ghanem Alsalem, consultant, internal medicine and gastroenterologist. Hello and welcome, doctor.
Thank you very much for having me. Thank you.
You're most welcome. So how are you doing this evening?
Doing very well, thank you very much. And the weather is getting better, so we are enjoying the coming days, inshallah, in Kuwait.
Yes, of course. The weather is getting so much better, so people are really enjoying it. They're going out more. And
exactly. Kuwait is very beautiful during winter time, and I advise everybody to stay in Kuwait, not to travel. It is beautiful here. Lots of areas you can visit. Now with the opening up of, getting out of COVID-19, a lot of activities is happening in Kuwait. So I hope for the best for everybody. Now after 2 years of lockdown, now we're back to regain our life again. So it's a good time to enjoy the weather and enjoy places.
Yes, of course, especially now that we're going back to normal life.
Yes.
So, doctor, could you please tell us what is colonoscopy?
Okay. Before we get into that question, let me have this chance to thank everybody for working hard to get over COVID-19. You know, the COVID-19, it's a threat to the human being for the last 2 years. We're facing this virus, dangerous virus worldwide. And in Kuwait, we did our best to overcome that. Special thanks to those in the front lines who gave their time and effort to make their life good for patients, give them the best care we can. And now we are, inshallah, seeing the lights to get out of this pandemic soon, inshallah, with the vaccine and everything like that. So this is a special thanks for everybody, and I hope everybody stays stick to the rules and regulations for the social distancing and masks as much as they can,
of course, yes.
And to follow the instructions to get us back to the normal life back again, inshallah. Back to your question, colonoscopy is a tool invented by human to look inside our bowel, especially the large bowels. We need this kind of tool to look inside the human to diagnose, to find and to treat anything it's related to the colon, especially to the colon for the large bowel, in the sense of infection, polyps, cancer, diverticulosis, a lot of terminology we can use and diseases we can find during colonoscopy. Colonoscopy is a very minimum invasive procedure we do for the patient to increase our diagnosis tools for the patient and to find our best way to treat the patient and find them a good plan for treatment.
Of course, so colonoscopy is used to diagnose so many diseases from cancer to a lot of things.
Yes.
So can you please tell us the colonoscopy, do you usually need to be under sleep to go through a colonoscopy or... And
good
why,
question.
please?
Good question. We've been asked this question a lot of time. So let me explain the colonoscopy in brief. Colonoscopy is considered to be a safe procedure. It's minimal invasive, as I said. The colonoscopy is a tool where we insert inside the human from their back passage to look inside the colon, the large bowel.
Yes.
And before we do that, we ask the patient to do some preparation. So we ask them to take the bowel prep. That's where we clear the bowels from all hard stools and to make it clean from inside so we can look inside. We use a camera to look inside. And the camera, this camera goes all the way and examine every single area of the colon, looking for anything suspicion or anything related to the medical condition. We put the patient in sleep. We don't put the patient in sleep unless they want to do that.
Yes.
But we usually advise them to take a light sedation. The colonoscopy itself, the procedure, is not painful, but we blow air inside to open the bowel. The bowel usually closed, so we blow air inside to open it a little bit, so patient may feel discomfort from this, feels gases inside. So we give them some medication to relax them. They will not be asleep totally and they will not be awake totally. So it will be semi-conscious sedation, we call it, in between. That's the majority of patients. We will use that. Some of the patients prefer not to take sedation at all, so we can perform the colonoscopy without any sedation. The patient is awake and can we talk to them and they can see what's happening around them. Some of the patients, special conditions or special circumstances, we may put the patient in sleep for a time of the colonoscopy. The colonoscopy takes about half an hour, 45 minutes, less than that. It depends on how much the bowel is prepared, and it depends on how much is the pathology we see inside. So it's not long procedure. It's very short, and the patient on the same day they can go back, practice their life as normal. So in normal circumstances, patient comes in prepared at home, with the bowel prep. They emptied their bowels. They come in the morning. We start the procedure, and after 1 hour or a couple of hours, they go home straight away and they start their normal life. So the sedation is not that much. Most of the patients we will use what we call semi-conscious sedation.
Yes, so you mentioned earlier some people don't prefer to take any kind of sedation,
Yes.
as you said, semi-sedation. So they might even feel a little bit discomfort.
Yes.
But it usually takes someone who has fear of pain.
Yes,
in
sure.
order to
You see,
go.
you have these patients who are actually afraid of doing any medical procedure.
Yes, of course.
And that's their right to ask for sedation and to ask not to see anything. The patient, they don't want to see anything. They want it to be in and out very quickly, sleep, good morning, thank you very much, we're done. So for these patients, the availability of sedation is there. For other patients, they want to be aware of what's happening. They are in charge of their body. They want to see exactly what's going on. And they want to ask questions. They want to share the information with you. They want to see what's inside their body. After all, it's their body and their right to ask. So we give them also the chance for that. So we actually sit down with the patient before we do the procedure, and we put a plan for the procedure, for the patient, and the patient is in control of this. So the patient leads us to put the best way to do the procedure in a safety mood with a safe environment, and the patient will be happy.
Of course, and they will be comfortable to watch and learn more about their body and what's going on.
Let me tell you, it's rarely you will see yourself from inside, so it's a good chance just to look inside and see what's going on inside your bowel. Yes,
and it's of course very scary as well.
True.
So who does need to get colonoscopy? Who are these people?
Yes, that's a good question. Patients who come for the colonoscopy, we have criteria for these patients to do the procedure for the colonoscopy. The main reason we do colonoscopy, or the main indication, let's say, for colonoscopy, we try to prevent cancer. Prevention is better than treatment, as we say in medicine.
Yes.
So we try to pick up these patients who may have the risk factors, or they have the opportunity to have cancer in the colon. You know, the large bowel, sometimes patients come late stage, they have the cancer and they don't know about it. So we try to pick it up early. In Kuwait, the Ministry of Health advised for this screening program for all the people living in Kuwait. Those who are above the age of 50, we advise them to do colonoscopy even if they have no symptoms.
Yes.
Male or female, above the age of 50, we advise them to do the colonoscopy. Simple procedure, in and out. You can go, take your appointment and do it, and it's very advisable. Why? Because we want to pick these polyps early. Polyps are just a small growth inside the colon, and they can grow to develop cancer later on in life. So if we pick them early and remove them with this colonoscopy, then you have, inshallah, safe life with no risk of cancer.
Yes.
So those patients who are above the age of 50, and they are not patients, maybe they have no disease at all, but those people who are above 50, male or female, we advise them to do a colonoscopy. Let me tell you something else. If the patient whose first relative have colon cancer at any age, let's say the age of 40, we advise the first relatives to start screening at 10 years earlier, so the age of 30. So if you are the 40 years of age and you have colon cancer, all your relatives, first degree relatives, your brother, your sister, your mother, your father, your son, your daughter, they should start screening at the age of 30. So also patients who have background history of other cancers, we may advise them to do colonoscopy. So colonoscopy is a good tool, easy, safe, quick, to pick colon cancer or risk of colon cancer.
Yes.
That's one. Other patients, they may have other symptoms, suggestive of inflammatory bowel disease. Inflammatory bowel disease is a chronic disease. Patients, they have ulcers inside their colon, and they may have what we call ulcerative colitis, or they may have Crohn's disease. And we are seeing this now in Kuwait, in our population here, either Kuwaitis or non-Kuwaitis living in this country. So we advise them to do colonoscopy, because colonoscopy, we need a biopsy to diagnose that disease. So we advise them to do that colonoscopy. Other indication for colonoscopy here in Kuwait, those who present with any bleeding from their back passage. If you have a blood inside, you see blood in your stool, or you go to the toilet and you see blood, we urgently advise you to see a doctor. You may need a colonoscopy. We also diagnose patients who have piles or hemorrhoids, internal hemorrhoids, during colonoscopy. So there are a lot of indications for colonoscopy. But my focus, I want people to listen to me. Those who are above the age of 50, we really need you to do colonoscopy, even if you have no symptoms. And this message should be across to everybody living in Kuwait.
Of course, and also as you mentioned, doctor, people who have relatives who has cancer, they should get colonoscopy at the age of 30.
Yes,
that is a very important information for people who are watching us at home.
Exactly.
And earlier, doctor, you mentioned that patients who go to you before the colonoscopy, they should empty their bowels. So what is the procedure before and after the colonoscopy?
So there are different protocols to do that. Every doctor has different protocol to apply, but generally we agree on something. The day before the procedure, we advise the patients to have a fluid diet. That means you increase your fluid intake orally, so you take water, coffee, juice, everything liquidy during that day. And then you, at some stage during the afternoon, the day before the procedure, you start to have the bowel prep. Bowel prep, you buy it from the pharmacy, or you get it from the pharmacy. It's like a powder. You make it at home with the solution, with the water, and it becomes a solution. And you try to drink it. In the past, it was difficult to take it. It was a huge, multiple liters. Taste is not nice. Now with the new bowel prep technology, there's a flavor now. There is a lemon one. There is a orange flavor. So you can take it, and it's easy for the patient to take them. So they take this amount of solution, and then they start to go to the toilet to empty their bowel. It takes a couple of hours to empty the bowel, and then everything is clear, no pain, everything is fine. The only thing matters, or most of the patients don't like going to visiting the toilet multiple times. But it's only temporary, couple of hours, and then you can sleep. You come in the morning, fasting, start the procedure, everything is over.
So during the procedures or the colonoscopy, is there any risks at all? Yes,
we consider it as a safe procedure. The risk associated with doing colonoscopy procedure is rare.
Yes.
Very, very rare. Maybe less than 1% of the patients, they may have infection or bleeding or perforation. And in these cases, we deal with this complication immediately. It's easy to deal with them. The risk is very minimum. It's negligible. We don't consider this as a risk. We tell the patients about it. The patient should be aware of it.
Of course.
But 99% of the time, everything goes normal. This happens with any medical procedure. Even if you take a vaccine, now everybody took the vaccine, huh?
Yes.
There is a risk with taking the vaccine. Less than 1% you may get a reaction, you get allergy. So it's same. Anything you do with any medical procedure in life, even with a simple needle or a colonoscopy or a surgery, there is associated risks. But we tell the patient, and we have to be clear about this, the benefit from the colonoscopy way above the risks. So the risks are very minimum. And they are negligible, so we don't really bother with the risk, and most of the patients, they go safely. There are some circumstances. The patient, they may have other medication. They take, for example, blood thinners. Patients on aspirin, or patient on Plavix, or patient on any other medication where they make the blood thin. We may take extra precaution, and we tell them to do some things before we do that. We may consult hematology or cardiology before do the procedure. Some patients, they may have diabetes, and we tell them different protocols to prevent any complication associated with colonoscopy. But in general, if you visit the doctor before the colonoscopy and you put a plan, the risk of having any complication considered to be negligible doesn't exist.
Of course, doctor, there is always side effects to any kind of procedures, even to medicine.
Yes.
Thank you so much for your time. It's a pleasure to have you with us on Hala Kuwait.
Pleasure is all mine. Thank you for having me, and I wish everybody to have a wonderful time and evening and wonderful winter in Kuwait, and good luck with everybody.
Thank you so much, doctor.
Thank you.
Dear viewers, we had with us Dr. Ghanem Alsalem, consultant, internal medicine, and gastroenterologist. Moving on to our next report about Kuwait heritage. Let's have a look at it. Stay tuned.